the question is, with some of the newer tools that we're using, like you saw the colorful slide on Cerner's Healthy Intent and Healthy Registries, will this change the way that the appointment feels, how long it takes, what goes on there? The answer is probably in some ways, hopefully the best ways, but the way that that platform is built, it should allow for things that can be done by others than the provider to identify those things. How much can happen before the provider even walks in the room? Perhaps it can make the visit more efficient if a person could say, in one snapshot view, all right, let's make sure we've got that colonoscopy coming up, we've got the mammography we've got to handle, instead of let me dive into this medical record to find out what else might be due. It helps to put it face up. So every additional minute that a person has to spend on a keyboard takes away some face time, and that's one of the biggest probably complaints as it's related to the medical record to date. But having something that works for you, doesn't fight you for the information that's already in there that you just need, is its goal. So it's early, still in the pilot phase.
So every time you go for an appointment, you won't necessarily feel like you're going in for a physical every time you're going for something?
No. Yeah, I don't think so. Good question. Others? Yes?
What about behavioral health? Now, if we're looking at behavioral health in this, isn't there some state law saying that not everybody should be able to see this stuff?
Right.
So how do we get around that? Is it the individual patient saying it's okay, you can share my information?
The resident expert is with us today. I know a little bit enough. I know, Jim, if you wouldn't mind joining us and explain. So, what Ruth was talking, Ruth, right? I haven't seen you in a while. You've been hiding upstairs, eh? What Ruth is talking about is there are some state regulations that prevent the access to your behavioral health component of your record. Jim, could you help us with that?
Actually, that is not accurate. There are only some federal laws, and they relate to substance abuse that we still need to address in order to make the record more open. But many systems, even some of the ones that are in our ACO, have already taken down the barriers so that everybody has access. If we're going to treat things like depression more aggressively, we need to understand that depression impacts anybody that has a chronic illness, has a 50% greater likelihood that they're going to also have a depression sometime during the course of their treatment. So the providers need to be able to communicate that information. They need to have access to that communication. And I know some, as I said, some of the other organizations within our ACO have already taken down the barriers. The issue now is how are we going to address the federal laws in relation to substance abuse.
Jim, do we have barriers today?
We do.
Yeah, so
We do.
if you've been in to see a person in behavioral health and then you go see your primary care, your primary care doctor cannot see what has happened in behavioral health? Is that accurate?
They can see the medications and any of the information that has been inputted by the physicians, but they can't see all of the record. And we're going to be working in the next year to take down most of those barriers. And the only ones that will be remaining are the ones that we're all struggling with, which has to do with the federal mandates in regard to substance abuse issues.
Okay. Thank you. Guest appearance. Not noted in the program. We'll give you the same level of compensation that we got paid to do this. Evan.
How do ACOs view each other? Do they work in conjunction with each other? Do they view each
Oh.
other as competitors? How does that work?
That's a great question. How do we view other ACOs as working in conjunction with or being competitive with? And I'll be straightforward. It's competitive. There's really only two meaningful, commercially known, for the lack of a better term, accountable care organizations in the state of Wisconsin. About Health and Integrated Health. Now, there are others. So Theta Bellin, they have a little accountable care organization in the Pioneer Medicare program. Not really competitive with them. That's a whole other deal that they applied for. And somebody else, Pro Health, started down that arena, and then they figured out that they didn't have the geography and the wherewithal to do it, so that's why they joined About Health. But I don't believe there are many other commercially organized accountable care organizations, and we are competitive, bottom line. If you look at all the geographies, would we work with About Health as we move forward? Nope. Why? Because we are directly competing for the same patients that they are. For instance, Milwaukee's probably the greatest, the most relevant example. Right now, Integrated Health Network would love to have Harley Davidson, or you pick the Briggs and Stratton, or Master Lock, or SC Johnson. And you know what? About Health wants the same thing. So it's all for one and one for all.
So if one of the ACOs comes up with a very useful metric, there's just no way that they're gonna share that with other ACOs that would, help improve patient care.
No. That's our competitive advantage. We're doing, now, nothing's secret in our worlds anymore. So if we're doing something great for Master Lock in Milwaukee, Master Lock's going to tell their peer group, and it's going to be out in the real world, and About Health's going to find out about it tomorrow. And there's really not much from a care standpoint that's so unique and so different that we're going to differentiate ourselves. It's really about price, what we're going to initially charge, or risk, how much risk are we going to take. And you know what? Master Lock wants to keep their employee health spend. They want to keep their employees healthy so that they're more productive and those types of things. But what drives some of those public companies is it's the dollars. Yeah. We have time for maybe one more question. Yes, Cliff.
This is a hypothetical question. Let's say that ACO meets every one of its goals. It's 100% successful. You have less hospital utilization. You have less depression, all this stuff. And you're meeting all your metrics. How would that impact healthcare for Agnesian and also in the state of Wisconsin? When you have a room full of people who would be directly impacted by people not spending money.
Oh.
Just putting it out there.
No. It's a great question. So whoever thought that we'd be adopting a business model that said we want to do less, right? We've always said, let's do more. In fact, influenzas hit us really hard, and we've been doing a lot, and our numbers are really good, right? We showed you those at the forums. So it is counterintuitive to business. So how are we going to offset that? So if we're going to care for everybody in a more effective way, that means you're going to be utilizing less health care, Getting back to my original slide, so the federal government and everybody's going to be spending less on health care, which needs to happen for us to have a sustainable economy and good and strong, vibrant communities. That needs to happen. It has to happen. So how are we going to exist? What have we been working on? Work smart, because we know we're going to have to live off lower revenues in the future. That's why we're doing that work, Cliff, to exactly your point. And then the second piece of it is, with Integrated Health Network, we're narrow in nature, and that our narrow network within Integrated Health Network is exclusive, right? So we're trying to capture more market. And so we're going to offset the decline in revenue by keeping you healthy with having a greater population that utilizes healthcare at Agnesian HealthCare. That's ultimately the vision here. And you're right, it is hypothetical. Because we don't know if it's going to work or not, but that's a journey. That's the journey we're taking, all right? But your point is a great one. I never ever thought I would say we're going to shrink our way to success. But in today's world, that needs to happen. So thank you so much for your attention. I'm glad you got to hear Mike DeGear today. He's a smart guy, a lot smarter than I am. So we're going to draw for this wonderful